blockage in your bile duct, and then you can get bacteria traveling up and into the liver. So you can actually get everything raised. So, case number 3. You've got an 87-year-old lady, inpatient, with a previous hip fracture, and now has a reduced appetite and is generally deteriorating. I'm going to start picking on people now. So, gentleman in the striped shirt, what do you think?
It's got a high output, but is that from a fracture?
That is from a fracture, very good, yeah. And output actually gets raised when you're unwell with anything. It's, again, one of those really non-specific things. So it could mean something, it could be nothing. If you've got a fracture, though, or had a fracture, that will be high. Okay. Lady in the purple top. Give it a go. Just forget what you know and just think common sense. What is raised in my 87-year-old lady with a hip fracture and a reduced height? Albumin is low. Now, albumin gets low when someone hasn't been eating for a while and they get very malnourished. So, does anyone know of any good tests to do if you suspect that you're, quite malnourished and you've got low albumin?
Magnesium.
Yeah, magnesium, phosphate, calcium, nutritional markers, yeah? So you want to check your nutritional markers. They might be deficient in something, which is also making them poorly. Now this lady's also got a raised ALT. What do we think of that? Yes, it's a hepatic thing, isn't it? But does she actually have any hepatic-like symptoms? No. So, one thing to mention about elderly patients, which is really useful to know, is that sometimes they don't actually complain of stuff when it hurts. It's kind of really annoying. I once had this lady who had really swollen ankles, she had a really swollen leg, and I said to her, and I'm thinking, this could be a DVT, she's been here for a while. So I said to her, is that leg really painful? Because DVT, hot, swollen, painful leg, right? So and she said, no, it's fine. And I poked it, and she nearly fell out of her chair. So sometimes they just don't feel pain until you actually press them. So what I would do in this situation is I would literally go and poke her tummy to see if it's hurting. And if it was, I would order a ultrasound. Yes, exactly. Same patient. You've got this is kind of hard, 27-year-old boy with end-stage renal disease. Is this the right one? No, sorry, wrong one. 35-year-old lady who presents with, wrong one again. Okay, here we go. 45-year-old obese lady presents with colicky abdomen. This one's up. Gallstones, wicked, and abdo ultrasound. Okay. 27-year-old man with recently diagnosed schizophrenia who is admitted to vascular surgery for stabbing himself in the arm with a pencil. Luckily, no major arteries were damaged. Is that what? Yeah, it is. Clozapine, olanzapine, they can cause a transaminitis. So all you have to do is stop it, and they usually just come back to normal. That is a difficult one, but it actually happened. And inflammatory markers. This is the very last slide. These are your inflammatory markers. There's not a lot to tell you about them. We don't usually order an ESR. We just use the CRP, and for some reason, most consultants prefer ordering the PV, the plasma viscosity, instead of the ESR. Usually because it takes longer to get, and probably some sort of cost issue there as well. Okay. Any questions generally? Okay, well done everybody. Thank you for your interest.